with a $4,000 deductible, and you just had an $8,000 ER visit. You pay the first $4,000 to meet your deductible, and then the second $4,000 would be split 50-50, meaning you'd pay $2,000 of that. So for that $8,000 ER visit, you'd be out $6,000.
Those numbers, just by example, 4,000 and 8,000. If it's the most normal number to work with as an example, oh man. Hello and welcome back. My name is Johan and I am a Dutchman, and I want to learn about everything that there is about everything. I want to learn more about the United States, and I'm reacting to all videos related to America. It's either about culture or costs or contrast, strong contrast. Yeah, so, and in the last couple of videos, if you're watching the channel, then you see that I went into the healthcare and healthcare costs, but I could not find any good explanations of healthcare, how this actually works in the United States. So I found, after I watched it, premium healthcare costs, then I found a couple of videos, so I want to take a look at them and then see if there is something I can relate to and explain how something of this costs in Europe or in the Netherlands. So I'm going to start with the first one because I see there is out of pocket and co-insurance and co-pay and out of network and all kinds of those words that I think, yeah, I heard something of it, but what is it really? So let's take a look at that one first. So I have the first one queued up, and now let's see. It's CNBC and Acorns, health insurance, premiums and deductibles. Okay, let's see if I can understand how the United States works with the health insurance.
Health insurance can get pretty complicated, but typically,
yeah, it can.
the point is to pay some money every month so that when you have an accident or sickness strikes, your medical costs aren't so expensive that they bankrupt you. Two of the most important terms in health insurance are premiums and deductibles. Your premium is that monthly cost. For many people who work for companies that offer health insurance, this premium comes out of your paycheck automatically.
Yeah. In Europe, every company is by law obligated to pay premium, partly premium of your healthcare, and the other half you pay yourself. But yeah, it's obligated by the company to pay from your paycheck. Yeah.
Deductible is very different. It's a number that signifies an annual threshold, and it's distinct for every plan. Let's say it's $1,000. That's the amount of
yeah. If this is deductible, okay, well, let's
money
see.
that you need to spend out of pocket on healthcare each year before your insurance starts covering your bill.
Yeah, we have the same. And again, it's the same as that she told me. Whereas if you have reached your deductible limit, then the rest will be paid by the insurance. But not everything that you do goes on the cost of your deductibles. So they say deductible of $1,000.
Deductibles range from a couple $100s to several thousand. These terms are related in one simple way. Usually, plans with higher monthly premiums, meaning you're paying more every month, often have a lower deductible, meaning your insurance company will start paying sooner. You might want to pick a plan like this if you know you will have significant medical costs next year. And the reverse is usually true too. Lower monthly premiums usually mean a higher deductible. This is probably better for healthy people who are willing to take a little more risk with their costs.
Yeah, it's the other way around, because I do not use a lot. I'm a fairly healthy person, and so I have my deductible rather high, so I don't have to pay that much premium every month.
Here's how that works in practice. Let's say you pay a $100 premium every month and you have a $1,000 annual deductible. You hurt your knee, go to the doctor, and find out you need to repair a torn meniscus. The surgery costs $5,000. You pay the first.
What? For torn meniscus? Okay, I assume this is just a case.
First 1,000, and so long as it's in network, your insurance then starts to kick in. Most plans pay a percentage of the remaining balance, typically around 80%. So of the $4,000 you still owe, your insurer will cover $3,200. That brings your total medical bill up to $1,800, even though the whole surgery costs $5,000.
What? Wait. You have a deductible, a maximum of 1,000. This means that if I have a surgery cost for 5,000 and I've reached my maximum of 1,000, then my insurance will pay the other 4, not the other 3,200, and I have to pay again another 800. That's not how this works here in the continent.
Of course, there are other costs and terms to keep in mind when talking health insurance, like copays and coinsurance, out-of-pocket limits, and knowing how your plan differs for providers in-network versus out-of-network.
In-network and out-of-network? Does she explain this one too?
But that's for another video. In the meantime, here's to a healthier you.
Okay. In-network and out-network. I understand now that we have deductibles and, how should you call it, co-insurance. And yeah, that brings it. So the deductible and co-insurance. But now in-network, because this is in-network, and then it has a checkbox as in you are in or out in your in-network. Okay. Let's see if the next video brings some more clearance to the question. Okay, I queued up video number 2. How health insurance works. What is deductible? I already know that. Co-insurance, co-pay, and premium. Okay.
If you have a health insurance plan or you're in the market for insurance, you may be feeling a bit overwhelmed and maybe confused by all the terms being used. Copay, deductibles, premiums, co-insurance, individual out-of-pocket maximum.
Out of pocket maximum. Yeah.
Add the fact that many of these can vary widely based on the coverage or plan, and you've got a lot to wrap your mind around. In this video, we're going to break down and demystify these essential health insurance terms, explain how the costs work for both you and your insurance company, and hopefully make you feel a bit more confident about how your plan works. So let's get started. Sort of the view from 10,000 feet is that there are 3 levels of healthcare costs, and the higher your costs for the year, the higher up you go. Level 1, level 2, level 3. On level 1, you pay for everything. When your healthcare expenses get to a certain point, you enter level 2, where you and your insurance company share the costs. And if the money you're paying out of pocket hits your plan's cap, then you enter level 3, where your insurance will cover everything further. We'll circle back to this at the end, and it'll all make a little more sense.
Okay. Level 1, level 2, level 3. Level 1 and level 2 never happens in Europe, except for shared, as in you have your deductible and that's it. It's the max. It's, I guess you could say, out of pocket pay. Yeah, but it's always they pay.
Sense. Now, whether your health insurance is provided through your employer plan, through somebody else's employer plan, or government-issued plan like Medicare or Medicaid, they all have a set amount for premiums, deductibles, copay, and coinsurance. These are all terms that represent your out-of-pocket costs. If you don't know what those figures are for your policy, contact your insurance company to request a copy of your policy. Now, I just threw a bunch of terms at you. Let's define these suckers. Premium. Think of your premium like a monthly subscription fee, like your Netflix subscription. This is how much you pay each month to keep your insurance active. And
how much is this premium? I want to know, how much do you pay?
You pay this even if you never go to the doctor. Just like with Netflix, even if you don't watch anything, you're still paying your subscription, right? Deductible. Your deductible is an amount specified by your plan that you have to pay in a given year before your insurance pays a dime. For example, if your deductible is set at $4,000 and the bill for your visit to the hospital was $2,000, you have to pay 100% of that bill. Bummer.
Yeah, that's not how this works here. I have a deductible maximum, but not all the costs that I do comes out of my deductibles. Yeah, some costs are really within my base package, and those are always paid by the insurance company and does not affect my deductibles. But let's keep on going.
But if your deductible is set at $4,000 and the hospital bill is $8,000, insurance would kick in to help cover half of that bill. Notice that I said it will help. More on that later. The good news is that this is an annual deductible, meaning that once you've paid that amount towards covered medical expenses, you don't have to pay it again until your plan resets. Often this is on January 1st, but that's not always the case. You should check with your insurance provider. When shopping for health insurance, it's great to look for a plan with a low deductible. However, there's of course a trade-off. Plans that feature a low deductible come with higher monthly premiums, while plans with lower monthly premiums have high deductibles. So why choose one over the other? Well, it comes down to what you anticipate your usage will be. If you usually go for 1, maybe 2 doctor's visits per year, you probably want a high deductible with low premiums. These are often referred to as catastrophic coverage plans because they aren't going to kick in until something really significant or catastrophic happens. On the other hand, if you visit the hospital a lot or you have some upcoming procedures, then you probably want to go with a high premium, low deductible plan. If you have a health insurance usage history, you can use that to help determine which kind of plan is going to be best for you. Copay. Your copay is a set cost that you pay for a covered healthcare service, such as visiting an in-network doctor, a specialist, or buying drugs. Let's say you go to see your doctor who charges $250 for an office visit, but your insurance has a copay of $50 for doctor's visits. You pay $50 and your insurance picks up the rest. Well, hold on a second.
Yeah, hold on a second. Copay. So you have a deductible, and then on top of your deductibles, there is a copay?
How do copays work if I haven't met my deductible yet? Because copays are paying for some of your medical expenses. Doesn't that not kick in until after you hit your deductible? Well, confusingly, it depends on your policy. So that's something you really want to check on. Here's a tip. Your insurance will likely have a list of preventative care benefits that they'll cover at 100%. No copay, no deductible, no coinsurance. These often include vaccines and many types of screenings, so take advantage of those. Coinsurance. Remember when I said that insurance would help cover costs that exceed your deductible? That's where coinsurance comes in. Coinsurance is a shared cost between you and the insurance company. So depending on your policy, it may say that after your deductible, you pay 20% and your insurance company pays 80%. That's called an 80-20 policy. Now for the ease of math, let's say you have a 50-50 policy with a $4,000 deductible, and you just had an $8,000 ER visit. You pay the first $4,000 to meet your deductible, and then the second $4,000 would be split 50-50, meaning you'd pay $2,000 of that. So for that $8,000 ER visit, you'd be out $6,000.
Those numbers, just by example, 4,000 and 8,000. If it's the most normal number to work with as an example, oh man.
Individual out-of-pocket maximum. Out-of-pocket is the amount of money that you pay. This includes your co-pays, doctor's visits, co-insurance, deductibles, drugs. And the out-of-pocket maximum is your plan's cap on how much you have to personally pay towards your healthcare costs. After you hit that maximum, 100% is covered by your insurance. Family out-of-pocket max. Based on what individual yearly out-of-pocket is, you can probably guess this one. It's the cap on the medical costs for a whole family. Now let's bring back the 3 levels example from the beginning. Now you start on level 1, paying basically everything out of pocket.
Until you have your maximum deductible reached.
That is until you reach your deductible, and that's when you go to level 2. And that's where you're splitting the cost with your insurance company through co-insurance. If your medical expenses get so high that the total of what you paid reaches your yearly out-of-pocket maximum, you move to level 3, where all further healthcare expenses for the rest of the year are 100%
Yeah, that's what he meant by 1, 2, and 3. Okay.
covered by your insurance plan. When your plan resets for the year, you start back at the beginning. Usually this happens on January 1st, but some plans differ on their reset date. If you're still feeling unsure about what this all means or about your financial responsibility for your covered services, your local healthcare facility can often help you obtain and understand this information, especially when considering an upcoming service or appointment. Hopefully this video has helped you feel a little more comfortable with the costs involved in your health insurance.
With the costs, yeah. But what the costs are, no. Okay, let's take a look at video 3. Maybe I get some information. Yeah, all right. Although this video told me a lot more than the previous one. But I guess we're not there because in network and out of network. Yeah, let's take a look at video 3. I queued up video number 3, but I see it is from 10 years ago, so maybe it's not that relevant anymore. Let's take a look.
Insurance plan to purchase and want to know how much is it going to cost? Well, it's not so simple.
No, it's not. I already understand that it's not so simple. Okay.
Sometimes you pay money toward your health care. Sometimes the insurance company pays money.
Sometimes.
But when? To figure it all out, there are 3 main ideas you need to know. Premiums, deductibles, and out-of-pocket maximum. It may sound complicated, but stay with us. It's not as hard to understand as you think.
Now, I already get that part.
First, premiums. Think of your insurance as a monthly membership. Every month, you pay the same amount in order to be a member. That amount is your premium. With your premium, say $200 a month, you get some preventive care for free. This includes care like vaccines and screening for diabetes, cholesterol, and breast cancer. This care is covered by your premium. But
Covered by your premium. That's the first time I heard this because all the other were talking about deductibles and not about, they did talk about the premium, but not that some basic stuff was paid by the premium.
what if you need more than just preventive care? If you need a health service beyond preventive care, illnesses, a broken leg, emergency room visits, you usually need to pay extra. How much? Well, that changes over time. There are 3 main stages. First, you pay. Then, your insurance
It's so ridiculous. First, you pay. I'm sick. You.
pays some, and you pay some. And finally, your insurance pays everything. So how does this work? In the
Not. It does not work. According to millions of Americans who does not even go to a doctor or a family physician. I don't know the real name for it, but because of the costs.
first stage, at the beginning of the year, you pay for most of your health care until you reach your deductible. Remember that word? Deductible.
Yeah, okay.
A deductible is the amount of money you have to pay for your care before the insurance company will share the costs. So let's say your deductible is $500. That means almost every time you get health services, you will pay for all those services until you've paid a total of $500. It's like you're filling up a bucket. Once you add enough to that bucket so that you pay your whole deductible, then everything changes. Then you enter into the second stage.
And you still
Now,
pay.
every time you get health services, your insurance company will share the cost
Yeah, and you still pay.
of those services. How much? That depends on your plan.
Your out-of-pocket max.
Usually, you pay part of the cost, fees called copays or coinsurance.
Or you're out of co-insurance until you have reached your out-of-pocket max.
And your insurance pays the rest. But the second stage doesn't go on forever. If you reach a certain amount, you won't have to pay for any services. Remember that bucket? Every time you fill it with copays and coinsurance, your insurance company is keeping track. If you fill that bucket up to the top, everything changes again. You enter stage 3. From this point on, your insurance company pays everything for the rest of the year. That's right, every dollar of your health services paid by your insurance company.
Yeah. Because I think it's 10 years ago, but look at my previous videos. It was, I heard what it was, 14,000, 4,500 for the physician, and then another, and then a total it was what, $104,000.
So what's at the top of that bucket? It's called your out-of-pocket maximum. This is the most money you will pay for your health care over an entire year. So let's say your out-of-pocket maximum is $2,000. After you pay your $500 deductible, and if you pay an additional $1,500 for various health services, you've hit your out-of-pocket maximum. From then on, you don't pay a penny more for covered healthcare services. It's important to know that every year, this starts over.
So every year you need to calculate that you need, in this example, to have $2,500 aside for your out-of-pocket on top of your monthly insurance payment. Okay.
So next year, you go back to stage 1 and need to meet your deductible yet again. So let's review. You pay a monthly premium to get...
Yeah, so you have your premium, whatever that may be, for an entire year. You have to have it. Plus, in this case, another $2,500 for your out-of-pocket max before the insurance pay everything else. And I even wonder if they would pay.
Get into the club and get many preventive services free. You pay for other services until you meet your deductible. Then, you and your insurance company share the cost of health services. You pay copays or coinsurance, and your insurance pays the rest until you hit your out-of-pocket maximum. After that, your insurance company pays everything. So, how much does your insurance cost? You will at least pay for your monthly premiums, and
How much? Give me a number.
at most, you will pay for your monthly premiums plus your out-of-pocket maximum. It all depends on the plan you choose and the care that you and your family need. You can get free help from a healthcare.gov assister to choose the plan that's right for your family.
Yeah. Okay. The second and the third video were explain a lot. I thought that the second one was clear enough, but I still don't know what is this premium you have to pay in the United States. Let me take a look if I can find it, because then we have a video that's complete about it. From Forbes, for the premium for an ACA health insurance plan is about $590 a month, and the average bronze plan costs $495, the silver 618, and the gold 655. And then I see average cost of health insurance by age. At the age of 21, the average monthly cost is $445. 27, 467, 500, 569, 7, almost 800. At the age of 60, 1,200 a month. The older you get, the more you pay. Okay, some are fair. Age of the member at Aetna, average monthly cost. Blue Cross, Blue Shield, average monthly yeah, okay. So let's take an average one of 40, age 40. The monthly cost is $622, $613, $495, and $582, but it does not specify what will be your deductible and what is the maximum out-of-pocket cost. So your OOP, I'm learning. By type, what is this? Average cost of health by metal tier. Age, smoking. I don't see it. Okay. So, for the age of 40, I see around 500. This is 600. This one we see in a state, Alabama and Arkansas and Florida, Hawaii, Alaska, 939. Yeah, okay, higher risk. 600, 500 a month. But that's not clear about how much is your deductible. Okay. So, let's say 500 a month, roughly. 500 roughly a month. Well, I had already the tab opened to make it the one that we use. And for a person of around 40, you have a deductible. If you have a deductible of 385 euros a year for your entire year, your premium goes up from about 140 euros a month. So when you reached, in comparison with the Forbes, because this is 500, by the time you reached 140 plus the 385 is 500, then everything else is paid by your insurance. At the moment you have reached those 385 deductible, comparing it with the US, then everything else is there. If I take a deductible of 885, because then I'm not using that much deductible, then my insurance will be of 120, let's say 130 euros. That's give or take $140, $145 a month for. If you expect, and that's what I say, this dentist, but if you expect that you have high dentist costs, then you can take an extra for your dentist, and then depending on what you want, but let's say you get 100% about to a maximum of 250, then your premium will be 150 euros a month. That's it. With a deductible of 885 and dentist covered until the number of 200. Let's take the expensive one. That's 100% to 1,000 euros a year. Then we find that the premium with an out of pocket, no, not out of pocket, with a deductible of 885, you will pay 190 euros a month. And that's it. Whenever you go to somewhere in the Netherlands, and I would say same kinds of premiums are all over Europe, but if I went on a holiday to Spain or to Italy or somewhere else, and I do a lot of biking around the region, and I'm on my bike, I am regularly in Belgium or I am in Germany cycling, and something happens to me in Belgium or in Germany, all the costs are paid for. Doesn't matter if I want to, if I need to go back from Germany, brought back from Germany to my local hospital, costs are covered, nothing there. If there's an ambulance, no problem, everything is paid for by this 190 euros a month. And that's for you. Oh, man. Okay. That's it. Now I know something about how this works, but still the question is, in network and out of the network, I believe there is something strange going on there too. Well, I hope you find this video informative. If you did, like and subscribe, and I will react in the next video. Bye.